So today we will be demonstrating a complete and partial bed bath. So the first step is to verify the doctor's orders. So we went ahead and did that. Then we're going to gather our supplies, hand hygiene, so we're going to wash our hands. Then we're going to provide patient privacy by closing the door or drawing the curtain. So we're going to draw this curtain here. Introduce myself. So, hello ma'am, my name is Joe. I'll be your nurse taking care of you today. And then, could I have your name and date of birth?
Crystal Guillen, 10/10/2000.
Okay. So here in a minute we're about to give you a bed bath. So that step is explaining the procedure that we're about to do. Assess the patient skin wise, so just make sure they're not they don't have any redness or anything like that on them. So this patient is fine. Ma'am, do you need to use the restroom or anything before we continue with this bed bath?
No.
Okay. And then we're going to put on a pair of gloves. And so the patient, the supplies that we gathered outside the room, we're gonna go ahead and bring them inside the room and put them on the bedside table here. Let's see. So for a complete bed bath, the supplies are gonna be a water basin. You need some washcloths, and then you would need to fill the basin up 2/3 of the way with warm water. I have some soaps here for the patient. And then for a partial bed bath, we're going to need pre-packaged wipes that have been warmed up. So supplies. The next step would be to place the bath towel over the top sheet and the patient. From there, you would ask the patient to hold on to the top of the towel, and then you would remove the linen away from yourself always. Dispose of this in a linen bag. And so with this, obviously all their extremities and face are exposed at this point, and you would continue with the bed bath. And so the first step would be you always start with the face when given a bath, and then from there you would do the trunk and upper extremities, and then from there you do the abdomen, and so you would start with the face, and then you would do the trunk and upper extremities, and then after that you would continue with the torso or the abdomen, and then you do the lower extremities, and then last you would have them flip over to their side with the bed rail up, and you would continue and finish with the back. So after we've given the bed bath and we washed all the extremities and the patient's back, you would ask them if they would like to continue with any grooming, whether that's, oral care, brushing their teeth, combing their hair. If it's a female patient, maybe have one of your coworkers braid their hair, brush it out. Let's see. And so after you've assisted with the grooming, you change gloves. So I've changed gloves. And then you would remove the soiled linen from beneath the patient. And so whenever you have to remove the soiled linen, you're gonna have to do some turning. And so before you do turning, you always want to make sure you have a side rail up, and then you always want to be cautious for any IVs, NG tubes, and catheters, and other things such as chest tubes, stuff like that could get caught and pulled out. Let's see. And so after we've changed the linens, you want to place the patient in a comfortable position. So I'm gonna place my patient upright like that. And so you would dispose of the used supplies after that. Wash rags would go with the linen in a linen bag, or if you have the prepackaged wipes, these are disposable. And then we are going to take off our gloves. Hand hygiene one more time. And then we would ask the patient if they're in a comfortable position. Then we would make sure the bed is locked and lowered. And then after we leave the room, we would document the bed bath, and then let's see. Oh, and then while documenting, you want to record the patient's ability to assist you with the bed bath. And we're done.